You post the job, you interview the candidates, and you spend 2 weeks training a new hire. And 6 weeks later, they are gone. That cycle is exhausting, expensive, and it pulls you away from the work that actually matters. Many practices try to fix this with outsourcing, but it often creates a new set of problems. Onboarding is messy, and patients feel like they are talking to a stranger, and you end up supervising the outsourced staff instead of managing your practice. According to data from the Medical Group Management Association, front office support staff turned over at a rate of 40. Kevin Schrock focuses on surgeries and consultations. His practice admin, Natalie, handles a relentless scope of daily operations. Every morning involves a complex balancing act. Natalie has to coordinate surgical consults while leaving room for the unpredictable flow of a walk-in sports medicine clinic. Beyond the calendar, the administrative burden is constant, managing sensitive medical record transfers and verifying insurance coverage before every visit to prevent billing gaps. A busy clinic cannot solve this volume with a rotating call center. They need a professional who integrates into their specific systems and learns the practice from the inside out. Staffingly assigned as the clinic's dedicated virtual medical assistant. Within a short time, this partnership produced a level of public documentation rarely seen in healthcare outsourcing. Natalie Schrock left a verified 5-star review on Trustpilot, specifically commending for his reliability and stating that he doesn't even feel like a remote worker. He is part of the team. It is rare for a practice admin to go out of their way to publicly praise an outsourced partner for their deep integration into daily operations. Even more striking is the second piece of evidence. A patient named Penelope Fields left a review on the clinic's own Google listing, naming alongside the in-house staff because she had no idea he was remote. When operational friction is low enough that a patient cannot tell the difference between a remote assistant and a physical employee, true integration has been achieved. This integration began with enterprise-grade security, worked through an encrypted VPN with full HIPAA compliance and SOC 2 Type 2 certification to ensure data integrity from day one. With the system secure, took over the front desk support. By consistently answering patient calls, he was able to build the kind of professional rapport that patients usually expect from an in-house staffer. This diagram shows the proactive insurance verification workflow managed. By flagging coverage gaps before the patient arrived, he eliminated post-procedure billing surprises. He balanced the complex daily calendar between surgical follow-ups and walk-ins, which led to smoother patient flow and a decrease in no-shows. Managed the meticulous process of cross-state medical records transfers, the specific task that prompted Penelope to leave her 5-star review. He moved beyond generic task processing by learning Dr. Schrock's specific preferences, turning his remote role into a functional part of the team. These operational results lead to a significant shift in the practice's bottom line. An in-house front desk hire in Fort Lauderdale costs between $35,000 and $45,000. A Staffingly VMA starts at $8 to $10 per hour, a 70% reduction. The savings also come from eliminating hidden costs like benefits, PTO, recruiting fees, and equipment. This model also removes the $12,000 penalty associated with the 40% turnover rate found in traditional hiring. Integration provides the stability of a full-time team member without the structural expenses of a traditional hire. Most outsourcing fails because of the rotating pool problem. If a vendor provides different workers every week, no one learns your specific workflows. This creates an accountability gap. Tasks fall through the cracks because no individual truly owns the front desk or understands the physician's communication style. Staffingly avoids this by assigning one dedicated professional. Succeeded at Schrock Orthopedic because he was trained on their specific workflows and held accountable for their daily operations. You can explore how a dedicated VMA would fit into your own workflow by visiting staffingly.com/demo or calling 800-489-5877. There is a 30-day free trial to get started. The results at Schrock Orthopedic show that a dedicated virtual assistant can bridge the gap between administrative stability and patient satisfaction. Clinics no longer have to accept turnover as an unavoidable cost of doing business.